Hi, everyone. Welcome to ICN Congress. We're at day 4 now. We're doing another impromptu interview with the amazing Michelle Acorn, Dr. Michelle Acorn, and she is a powerhouse. I'm going to let her introduce herself and tell us a little bit about her background and what she's currently doing.
Thank you so much. I'm just thrilled to be here, and it really is impromptu as well. So, as mentioned, I'm Michelle Acorn, and I'm the inaugural chief nurse for the International Council of Nurses. You may not know this about me, but I am diploma to doctorate prepared. Actually,
Wow,
I
that's
completed
amazing.
thank you. I completed a postdoc as a nurse at 19, almost 20 years old. You may not know, actually, my mother influenced me to become a nurse. And I was named after a nurse that cared for me in the hospital.
Oh, wow. That's really neat.
And I also would like to give a shout out before I forget to my daughter, Andrea, who is a registered practical nurse, and she just bridged and she became a registered nurse.
Oh my goodness,
Amazing.
congrats.
So I
Following
think
in
that's
your
also
footsteps.
important. I worked full time while raising a family, and I completed a Bachelor of Arts in Health, a Bachelor of Science in Nursing, then my primary healthcare nurse practitioner,
Wow.
then my acute care nurse practitioner master's.
Oh my
Then
gosh.
I was one of the very first to do cross-border education, and I went to Deauville, and I completed my Doctor of Nurse Practitioner, or Doctor of Nursing Practice, you may know about it,
DNP, yeah.
DNP, which is also a unique
Yes.
opportunity here as well when we amplify a doctoral prepared nurses. And then I just completed 2 postdocs while working full-time at ICN. I focused on system chief nurse executives as well and system leadership. So my career trajectory was for registered nurse. I was always community hospital based as well. The emergency department first, starting as a nurse practitioner, the first NP in the
Wow.
emergency department.
That's amazing.
Then weaved to a hospitalist. Then started the GAIN clinics. You may not know about them,
Oh,
but
wow.
they're the Geriatric Assessment and Intervention Network clinics.
Wow.
And
that's
then
amazing.
actually started the first nurse practitioner-led hospital.
Oh, wow.
What?
Well, you talk about NP-led models of care that are
Right.
interprofessional, where we change legislation and regulation and full scope of practice as well. After almost 30 years, I left hospital to go to the government, and I was a government chief nursing officer for 3 years, and now in this role at ICN as the chief nurse to really advance health and social policy. We represent 28 million nurses,
Oh my
Wow.
gosh.
136 national nursing associations, and we're the global voice of nurses around the world.
Wow. I don't even know what to say. And that is quite the journey. That's amazing. And I think that that is actually really inspiring to hear all of the different pathways that you've taken to get where you are. And now you are the ICN chief nurse. So could you tell us a little bit about some of the priorities? So you mentioned the 2 of the focuses that you're working on right now, but what are some of the priorities that you might have that so we can tell other nurses in terms of what the ICN is doing as well?
Great, thanks so much, Amie. The priority right now is after the COVID effect, we're in a health workforce tsunami.
Yes.
The health workforce pandemic is the live reality, and we need to recruit and retain, more importantly, retain nurses, respect, recognize, make safe, decent working conditions for them, ensure they're remunerated well, ensure they're at the decision-making tables, they're included in every aspect of data, dialogue, and decision-making. So when you talk about the top priorities right now, the World Health Organization, we have the Global Strategic Directions for Nursing and Midwifery. This is Sentinel because we're halfway there, and the pillars are leadership, education, service delivery, and jobs. I'm not sure if you heard Dr. Tedros announce that we're going to have a second State of the World Nursing
Yep, I
Report.
heard, yeah.
This is important because we need to capture nursing contributions and how we actually truly invest in nurses. Money,
Yes.
getting them to the tables, making sure we have positive practice environments would just be a few. And remember, ICN, you've learned here, we're low, middle, and high income countries.
Yes.
We need to invest in nursing leadership, that they have the competencies, the confidence, and more importantly, work as a collective to advance universal health coverage, the sustainable development goals, right? And we really need to move forward on this because we need to raise the crucial conversations. When emotions are high, stakes are higher.
Yeah.
People's lives, and more importantly, advancing the profession and ensuring that nurses are vital, valued, visible, and vocal.
That's amazing. Yeah, I'm going to pass it to Sarah.
Thank you so much for your insights. I think that's really important that we just really think about how we can advance as a profession. And one of the themes that we've heard over and over is just about the idea of unity and the fact that we do have strength in numbers. We are the largest group of healthcare professionals, and together I think we could make so much change. So how do you have any ideas how we can sort of unite better as a large global workforce, knowing that we're the backbone of healthcare?
Thank you so much, Sarah. I mentioned earlier, for example, we have 136 national nursing associations right now that are members of ICN. If you think about this, are nurses members of their associations? Are they attending? Are they actively contributing? When you even think about the landscape, and we're all from Canada right now, you may have your local organizations at your hospitals, in public health and community. You will have your provincial associations, for example, as well. Then you'll have your national associations, and Canadian National Nurses is our association and a member of ICN as well. We need to be united in our messaging.
Yes.
And it's that elevator speech, and it's the latte chat. What nurses have that we contribute? What is the value added of our profession as well? When we get into granular talk that's into weeds, if we're advocating to provide strategic thought, expertise, and knowledge, for example, to the government, remember, we're the experts, they're not. We need to package things up that how we're meeting societal needs, I think is really important as well. And to ensure that nurses are able to improve access to care.
Yeah.
That is the message, but we all need to be saving and ensuring that we are sharing the same message together. And what is that? You know, the message is nurses are vital and vocal, but we need to ensure that we're at the table to inform on the decisions, the programs,
Yes.
the data in terms of how do we utilize the data and analyze it. I think that's important as well. And if we don't unify together and we take decision making or investments in different directions, it actually makes it a bit more dilute.
Yeah.
What are the big issues? Health workforce, safety and protection, access to care, full scope of practice, enabled, empowered. Those are the issues right now, and respectful, decent working conditions and upholding human rights.
Yes. Absolutely. Yeah. I have one last question, and I think this is the other big question that we're all thinking about, especially in terms of the work that needs to be done on a global scale, national scale, whatnot. And I think about all of the different things that you mentioned, and the other thing that always comes to my mind is mental health. A lot of nurses are tired. We know that we need to do this work. We know that this work is hugely important. And when we talk about like membership numbers, we were hearing, some membership numbers might be going down. They might be getting a little bit better. But how do we energize nurses? How do we get them back at the table to feel that, this is important to me? Because I think that at some points we think that, maybe my individual voice doesn't care. Like, people don't care about my individual voice, or, I don't have anything that I can contribute, or, I've said what I've said and nothing's going to change. What do you say to those nurses, or what can we say as a collective to re-energize nurses to be involved in this movement?
Thanks, Amie. First of all, I'd like to applaud both of your leadership. Maybe they need to, and hello to everybody as well. We have a moral imperative right now. We have endured massive trauma. as a result of the COVID effect, as a result of chronic understaffing, and just the conditions of our work. And it makes you emotional when you hear about the stories, but I think a good example would be here today. When we're hearing about what we can do, we have to invest in ourselves, we need to speak up, and I have this mantra, intent to lead, L-E-A-D, versus leave the profession. I think we need to hear stories, we need to recognize and acknowledge and respect, but we need to continue to be at that table, because if we want to make things moving forward, if we want action, we need to continue to do that. And whether you're on the front line, I don't like that term,
Right.
delivering care as a clinician, an educator, a researcher, a scholar, or a leader, we need to show these spaces can be really lonely, and leadership takes a lot of courage to speak out. And we remember we need physical and psychological safety, and we need to articulate what we need. There's not a quick solution for this. There's many mechanisms that you can, do whatever works for you for self-care, and we're fortunate enough in a privileged country where we are to have access for extra psychological services. But we need to speak up right now, because if there's not a better time in a political cycle,
Right,
let
100%,
alone
yeah.
where we're at right now, we need to continue. And that investment is in mental health. Stay tuned. We have some great mental health guidelines coming out right now. And I think we just need to continue to share our stories.
Yeah.
Narrative storytelling shares a lot. I don't know if you were in the patient safety session yesterday, where it was shared for some of the enduring losses, patient safety, nurse safety. This is the mental health that we endure and the moral distress. And we need to share our stories and to show why it's important to invest in nurses, as well as invest in nurses' mental health, not just their clinical skills, their competencies, their cultural capacity as well. And we need to think about mental health capacity.
Yeah. I mean, I think that when I think about why we started this mission, why we set out to start having these conversations, was because we felt alone and that nobody was listening. And I want people out there who might be listening to this today to know that we are listening, and that there are many solutions, that we're looking forward to achieving some of the things that we set out, and that you're never alone in these situations, that we're always working towards. And if you are ever feeling that you're alone, please feel free to reach out to us. But again, thank you so much, Michelle, Dr. Michelle Acorn, for coming on our Gritty Nurse Impromptu podcast. Is there any last words that you'd like to say before we wrap up today?
I encourage everybody to reach out and connect. It's not just about mentorship. You were talking about the mental distress. When I meet people, sometimes they tell me their story, and they're at a critical point in their professional lives right now, where some are rejuvenated and they've recommitted that intent to continue to lead and move forward our profession and ensure we're providing access to care, and others are just signaling intention to leave the profession, as well as mental health instability, frankly. And please, if you're feeling unsafe, please reach out to someone, contract with someone, reach out to all of us, because you're not alone. That's the number one thing, because we leave no one behind, and I want to make sure we leave no nurse behind as well. And I think that's important. And sometimes you just need to talk to someone and get inspired. And I just commend you both as well. And I think we need to amplify nurses, the image, and opportunities as well. So thanks for this impromptu.
Thank you so much again, Dr. Michelle Acorn. We're so thankful to have you as a fellow nurse, as a supporter of nurses, as an inspiring leader. We really value the time that you took to speak with us today.